This video will go over ophthalmic drops and ointments, some points to look for before administering them, as well as the proper way to administer them. Moving on to eye drops, they are of particular concern when it comes to storing them. You want to ensure that they are stored separately from regular medication as well as separate from ear drops. You're going to ensure that you have washed your hands for at least 20 seconds, both immediately before and immediately after administration. The abbreviations for both eyes, right eye and left eye, are provided here. We have both eyes as OU, right eye OD, and left eye OS. The pharmacy label should have the location spelled out. It should not be abbreviated. So if you notice on your label it is abbreviated, please let us know and we'll get that corrected right away. When administering eye drops, ensure that you're giving any kind of dilators first, and then you'll give the steroids, and then any kind of lubricants if it is applicable for that resident. Then when administering those different types of medications, ensure that you're waiting 5 minutes between the different types. So 5 minutes between the dilators, 5 minutes between the steroids, and 5 minutes between the lubricants. If you have multiple drops of the same medication, you're going to just wait 3 minutes between each one. Avoid touching the tip of the dropper to the mucous membrane. If you have touched it, you're going to want to replace that medication because it has then been contaminated. And see any kind of policies that your facility might have as far as the administration and any kind of infection control when it comes to eye drops. If you have a suspension, then you're going to want to make sure that you shake it well or even just roll it between your hands to mix that medication. After you've administered the eye drops, you're going to hold the lacrimal duct, which is just the tear duct in the inside corner of the eye, for 1 minute, and this is going to prevent any loss of medication through that tear duct. And here is a picture administration of administering eye drops. Eye ointments. These are always administered after eye drops, and if you need to steady your hand when placing the ribbon of ointment in the resident's under eye, you're going to just rest against the resident's forehead. It's a very similar procedure to eye drops, just instead of placing a drop, you're going to be placing a ribbon along the inside pocket of the bottom of the eye. Do not place the ointment directly on the cornea or directly on the eyes or eyelashes. An ophthalmic test, should they be stored together along with otic solutions? No, they should not. Should the eye drops be placed directly on the cornea? No, again, they should not. If you have 2 eye drops of the same medication, they should be given at least 3 minutes apart.